Hello. Good evening from Philippines. Kamusta po kayo? Hello, kamusta? Hello. I will be talking about knee pain, so we'll just wait to the other with the others. So if you want to learn, good PM sir, how to get rid of pain sa shoulder blades. Okay. So our first topic will be shoulder blade or upper back pain. So actually your upper back pain or the shoulder blades is connected with your shoulder, okay? So if we want to reduce the pain of the shoulder blade, we want to apply some shoulder stabilization exercises. So I will be showing you, okay? First, I will be using this flare band just to activate your scapular muscles. So this is just a live demonstration on how to get rid of your pains. So make sure to share this live so that we can help others. So we have our first topic will be how to get rid of this pain. So I want you to use this, okay? So first thing is we can do some T-spine rotation just to promote some mobility in your spine and to activate your back muscles. So first, 90 degrees and half kneeling, and shoulder will be aligned with your arm. Make sure to do this movement, but we want to use this band just to activate your rhomboids or scapular muscles here. Hold this for 2 to 3 seconds. Perform 2 to 3 sets. Then you can also use some thread the needle exercises. For example, this is your pain. You can perform this. Stretch here. Make sure you can feel stretch here. Hold for 3 to 5 seconds. Then back. Okay, you can do that, and I hope it helps. Two to three sets, then 10 to 15 reps. Okay. So the important thing is just to you can also do some activation exercises. The most common problem with the upper back pain is because with our slouch posture like this. depending on the situation. So we want to reverse that. So 90 degrees, activate, just press back. So you can feel your muscles contracting here. So same 2 to 3 sets, then 10 to 15 reps. Exercises or workout routine after po ng meniscus injury. Exercises or workout routine. So if you have meniscus problem, it's really important to regain your mobility of your knee. So you don't want to strengthen your knee if you have lack of knee extension and flexion. We want to address this first. So again, you don't want to introduce some strengthening exercises, sample squats. Then if you still have problem with your extension, so we want to promote some knee extension first. For example, if you have problem straightening your knee, use a pillow or a foam roller. Straighten this, then put some weights here so that you can promote some extension, and hold that for 30 seconds. Then you can also do some knee extension. And you can also do some wall squats just to activate or strengthen your quads. And it really depends on the phase or your problem. As long as you don't want to force right away with the sports strengthening exercises, you want to promote or gain first with the mobility, which is the straightening and the bending. So if you want some meniscus rehab exercises, just check my rehab playlist about knee or meniscus, okay? Masakit po yung anterior deltoid ko dahil sa pagtulog ko palagi sa right side. Ano po pwedeng gawin? Pagtulog. So depende po yan, Ma'am Rans. If you have frozen shoulder can trigger especially when you're sleeping on your side. So it really depends if it's a rotator cuff problem. So for the pain, we want to address the pain first. Just do some ice compress, rest, modify your activity, especially lying down on your right side, or especially on the area of the side. And it really depends on the case. Have you consulted it with the doctor first? So if it's really a frozen shoulder, that could be a painful, especially when you're sleeping. Thank you. Been dealing with so much pain on neck, shoulder. Yes, it's very common to develop some pain on your neck, shoulder blades, even in the middle back, because it is connected. So we want to determine the problem first, which is the slouching, or people who are working at home, laptop, front desk. It's very common. So we want to promote some opening on your front. So that's the common causes of the neck pain, shoulder blade. So just do some like this, or stretch. Do a wall stretch like this. Stretch your front part. And you can also do some chin tucks like this, because as we work a slouch posture, our necks move forward. So we want to do some chin tucks. Okay, it's easy. Patellofemoral pain. So if you have knee pain during jumping, running, bending, so we want to activate your quads first, which is here. I'm gonna show you some anatomy. So I want to show you with my best friend. So this is your patella femoral, your patella, your quadriceps tendon, your thigh muscle, and this is mostly the painful site, right, with the patella femoral. You want to activate your quads first here. This is due to the mechanism of your patella. So we need to correct the quads first. You can do some quad settings, wall squats, slow lunges. So emphasize the eccentric part, which is the lowering. So you can perform like this. You can perform, for jumper's knee, you can perform some isometrics, like here. We want to activate your quads. You can also do some wall squats, like this. You can progress this by doing some one leg squats, one leg wall squats. Get your contraction here, and you can also do some forward lunges. You're welcome, Sir Chocks to go. Ma'am Rance, wala po, pero 23 years old. So 23 years old, hindi po possible na frozen shoulder yan, no? Medyo bata pa. I don't know if you have any history of accident, injury, but make sure to limit or avoid the activities po na nakapag-trigger ng pain. Teka lang, pahinga muna. Whew. So again, for your shoulder pain, when you're sleeping, make sure to modify it po. Pwede po kayo turn to the other side, but you can do some ice compress if it really hurts. Ice compress, make sure to protect it. I don't know what kind of sport you're participating at, so make sure to lessen your activities. And invite another. Jumper's knee po with posterior shin splints. How many weeks po ba kaya for rehab? For jumper's knee, actually it usually takes 8 weeks. For jumper's knee, 8 weeks. It really depends also with the rehab process, the exercises, but usually 8 weeks. Super painful po sa knee pag nag-i-squats, normal po kaya. Yes, if you have jumper's knee, patellofemoral pain syndrome, patellar tendinopathy, it's really painful when you bend, squats, jump, running. It's because of this mechanism of your patella. So as you bend your thigh, this patella also goes up or move. So there's faulty or wrong mechanics of your patella. So we just want to activate your quads properly and train your knee muscles, especially here, so that they can activate when you bend. What happens is this can rub here, the patella. This is your patella. This can rub on your bone. So it is jumper's knee is a chronic, repetitive, inflammatory knee pain. So when you lessen the activity, sports, bending, it usually relieves the pain. Dos MCL tear po, paano po ba ito i-recover or train? 18 years old, 3 months na po itong injury. For MCL tear, for example, so this is your MCL. For example, this is the outer part. This is your right knee. This is the LCL, MCL. So we want also first few weeks we want to regain the mobility, limit the pain, inflammation, So it's at the same process with all problem. So first we want to stabilize your knee by strengthening your quads. I can show you some playlists of knee rehab. Just check my playlist on knee rehab. I have so many MCL rehab exercises. So just to show you some picture, this is your MCL, this is your meniscus, this is the blue one, meniscus, and this is your patella, this is your quads, and patellar tendon. Trucks to go after ma-injury ng meniscus, normal lang po ba yung pain sa gilid ng knee and sa likod? Yes, if you have ACL and meniscus, actually ma-differentiate natin yan. For ACL, there's no pain upon bending, okay? But for meniscus, there could be pain when you bend, walk. But for ACL, there's an instability or parang nagwo-wobble or parang walang lakas yung tuhod. So yes, normal po na you can feel some knee pain when you bend, especially you injured your meniscus. So this is your meniscus. So when you bend, so this thigh will bend. Tapos ito may parang naglalak dahil sa meniscus tear. Hope po nakasagot po. Another question. If you're asking about sciatic pain, slip this. This is your vertebral column. This is the spinal cord. The yellow one is your spinal nerves. And slip this or this herniation. This is the red one. If the disc becomes dislodged, this could impede or irritate some nerve, which goes down to your lower leg. So I'll be posting YouTube videos about sciatic pain. But if you want to look for the playlist of my sciatic rehab, you can check sa playlist ko. Taya on. You're welcome, Trucks to go. Ask ko lang po why kaya pag kino-contract ko left legs ko pag nagko-contract. Okay. So this is also a very good question. For example, Real Chick tries to contract or move her quads, which is your thigh muscles, which is found here. So when she tried to contract or move here, this is very normal if you have knee injury, ACL, meniscus. That's why we need to regain the activation or the strength by doing quad settings or the squeezing part. But it's very normal for the first few tries when you do the quad settings. So what you can feel is the back part here, the back part or your calves will be contracting. So there's some faulty mechanics about your knee. That's why rehab takes weeks, months just to re-educate your muscles to work properly. So by just doing some quad settings, just do it slowly and be patient. You can't overcome it just by night. So make sure to do that consistently. Masakit po ang baywang ko pag nag-basketball, meaning po nun ay mahina court. Pag baywang po, hindi naman po, okay? Depende po yan if possibility ba na gluteus medius or yung parang nasa gilid ng hips natin or ng butt area natin. For example, this is the front part of your body or the lower sa hips. Tapos, sa likod naman po, here we can find some gluteal muscles or hip. So, madami po mga muscles dito. So, one muscles po na I really have common sa mga patient natin, especially basketball, no? Naglalaro tapos medyo nanghihina yung hips, tapos nawala ng lakas. So, yung gluteus medius, nandito lang po yan. Part lang po yan ng mga gluteal. Madami po yung mga gluteal muscles. But, this po na muscle is responsible po na mag one leg stand tayo. For example, galing po kayo ng rebound, tapos one leg lang po yung nagland. Yung gluteus medius, which is this muscle sa kabilang paa, if weak yun, or nagmasospasm or na-strain, there could be some weakness on your leg. That's why many people experiencing it, but it doesn't mean na weak po yung core nyo. Okay? But if may pain po kayo while standing, so possibility lang po yan is dito sa likod nyo, sobra lang po yung contraction ng mga back muscles nyo. So that's why we need to strengthen your core just to counteract the balance. So again, if you have pain while standing, this could be due to overweight, muscle strain. Tapos itong muscle na to, itong curve na to is pwede siya mag-increase. So yung mga back muscles mo is contract palagi. That's why we need to engage your core para mabalance yung dalawa. So that's the time we can consider na weak yung core natin. Okay? Thank you po sa gift, Miss Ralshay. Another question. Thank you for the gift, Miss. Another question. Call follow. Paano po ang rehab ng MCL? Kakadiscuss ko lang po sa MCL, no? So, first, we need to understand first where's the MCL. So, example, this is your right knee. Ito yung quads natin, thigh, patella, kneecap. And sa medial part, or sa inner part, this is our MCL. And sa outer side ng knee natin, LCL. So when we if may mga lateral force po dito, tapos ma-stretch to, so there could be a possibility of MCL strain. So overall, we just want to strengthen this part, yung adductor muscles natin. So if you want to check it, I have a playlist about MCL or knee rehab. So strengthen natin dito yung adductor or thigh muscles. We also want to strengthen our quads, which is the front part. We also want to strengthen our hamstring, which is the back part. And after weeks po, as soon as pain and inflammation subside, but for the first few days, medyo maga pa to. So we don't want to introduce some strengthening, jumping exercises. So we want to focus first with the pain inflammation, okay? So rest muna, wag muna ipilit yung laro, ganun. Make sure respect natin yung pain. So as long as mag-regain na po yung mobility natin, ma-straighten, tapos ma-bend na po fully, walang mga difficulty upon movement, so pwede na tayo mag-strengthening yan. So dahan-dahan lang po yan, no? So if you want to check my playlist about MCL, I have playlist, check nyo lang po sa playlist ng profile ko. Madami po yun. So make sure there's no pain upon doing that, okay? Allowed po ba mag-exercise if ever mag-start po ako ng rehab? Like cardio, rest. So there's many conception, no? Pag na-injured po tayo, advice ng iba na, or mga ibang tao is ayaw na nilang gumalaw, ayaw na nilang mag-sports, ayaw na nilang mag-exercise. Actually, mali po yun, no? If you have pain, any or injuries, you can still do workouts, okay? But not to the point na yung sports na intense talaga, tapos after few minutes magti-trigger yung pain. That's the point na hindi po matamang exercise po yun. But we can do some exercises, especially if you work out, regress your squats, modify your activities. For example, nag-squat kayo, don't do some barbell first. You can do some machine, you can do some leg press, leg extension, regress it, just use body weights. So just make sure that the pain didn't trigger. So pag nag-trigger yung pain, tapos pag rest nyo, nag-i-increase yung pain. So ibig sabihin niyan is too much lang po yung exercise or too often. So regress muna tayo. So allowed po mag-exercise. Depende po yan sa exercise or training, especially if you have rehab, okay? So as long as hindi po siya mag-trigger ng pain, okay? So misconception talaga yan, no? I see a lot of patients, no, pag may back pain sila, sabi nila is completely rest na lang, so walang activity, so bawal po yun, no? So make sure may activities po tayo, exercise kahit konti lang. So I will be posting the low back pain exercises, sciatica. So mga simple exercises lang po yun na pwede natin gawin. So bawal po yung walang gagawin talaga pag may pain. Sir, yung tibia ko parang mga ilang months po yung... So if you have tibia problems, depende po yan. If you have fracture, this is your tibia, your lower leg. Depende po yan. Or if you have shin splint problem, depende po yan. If shin splint problem is mga 8 weeks or 8 to 10 weeks, depende po yan. If you have tibia fracture, medyo matagal yan. Depende din sa klase ng fracture. If it's mild, moderate, or complete fracture, depende din po yan, no? So, madaming factors yung recovery. Thank you sa gift po, Miss Rels. Thank you. Sir, 3 months, sir, nakakatapos ko lang po mag-exercise. Pwede po ba kahit na So ito, listen up. So we have question here. Sir, kakatapos ko lang po mag-exercise. Pwede po ba kahit na mamaga pa po? Okay, so if you have pain, inflammation, okay, pamamaga, swelling, pain. So factor po yan. Actually, useful po yung pamamaga, okay? Because it assists with the healing process, no? Pag ini-interrupt natin yan, madidelay yung healing process natin yan. So madami po mga nagko-comment dito, no? Bakit 1 year na daw yung pamamaga, ganun. So nangyari niyan is chronic inflammation na po yan, no? So actually with the inflammation, it usually takes days to weeks para lang bababa yung pamamaga. So if ever medyo matagal na yung pamamaga, it means po na yung intensity ng exercise or activities nagti-trigger ng inflammation. So what it meant po is nade-delay yung healing process ng injured parts nyo. So make sure again ito sa first phase 1 rehab, control muna natin yung pain, inflammation, swelling, lack of full range of motion. If ever nag-exercise po kayo at anything that you do, walking, tapos nagdi-trigger after rest or after doing that, nagdi-trigger yung pain, pamamaga, it means too much lang po yung activity. So you're interrupting the healing process, okay? So make sure pakinggan natin yung reaction ng body natin. So ibig sabihin yan, you can regress. Sir, if you have pamamaga or nag-i-increase siya after the exercise, make sure na to determine if i-lessen mo yung frequency or gaano kadami per week, and intensity, gaano ka-intense or gaano ka 100% ka ba or gaano ka full force. Tapos mga activities, is it jumping, is it jump ropes na exercise, is it gym workout, is it biking. If nagtitrigger yan, limit or avoid natin. Okay? Okay, Sir Jello, tibia fracture, depende po yung mga 8 to 12 weeks, depende anong klase ng tibia fracture. Depende po yan, may mga klase may longitudinal, pag ganito, depende po yan, may madami pang ibang structures na affected. So mga months talaga yan. Pag fracture, pang mild fracture, konti lang yung fracture, mga 4 to 6, depende din sa rehab. Sir, me again, how much po kaya abutin ng surgery sa grade 3 MCL? Depende po yan, no? Ang gasto, una is a professional fee ng doctor, ng surgeon. Second is charge ng hospital. But I think mga nasa 80 up ata. Di pa ako nakapatry ng MCL, but mga ACL na try na po ako. Madami po akong mga patient. Pero for MCL, wala pa po akong specific or na range, I mean na price, but mostly up talaga 80k. I don't know, depende din. Mga nasa ganyang gastos po. Sole use workout po. So if ever sole use, no, for example, ito po yung kneecap nyo, no, sa likod niyan, ito po yung calf muscle natin, ito po yung nagka-cramps tayo, no. So on your lower leg, for example, ito po yung calf natin, calf muscle natin. Ito yung soleus dito. So when we try to do heel raises, actually yung gastroc ang na-exercise niyan. So para ma-target natin yung soleus nandito, so we want to bend your knee, tapos heel raises. Ito, heel. So, hold nyo lang dito sa taas, tapos matatarget na din yung soleus. If you try to straighten your knee, calf muscle yan. So dito yan, calf muscle. So, yan lang. You can perform some walking like this, tapos nakatiptoe lang. You can also do some here. Depende po yan. You can also do some balance to target your strength and stability sa ankles nyo. Like this. Or, depende po yan. Um, 40 years old, pwede ba mag-squat? Masakit yung tuhod. Yes, there's marami pong kind of squats, no? And for example, if you're 40 years old, tapos konting squats lang, konting bend, masakit na. Tapos yung sakit, nasa 5/10, medyo mataas, huwag muna ipilit. So, instead, you can do a wall squats, like this, tapos bend. Kahit hold mo ito mga 5 seconds, goods na yan. Mafe-feel mo dito that your quads are working. If ever easy lang to, you can bend a little more further po. Pag masakit, dito lang muna. And you can also kapit lang po. Pwede po kayong kumapit. And one leg. Ito. Hold nyo lang. Make sure yung hold, ito yung pinaka-importante. Ma-feel nyo yung quads. But if you go down, tapos ma-feel nyo yung pain, make sure up lang po tayo ng konti. Okay? Hindi bawal yung squat sa mga 40 years old, okay? Teka lang, charge lang. Pwede po ba mag-shooting and dribbling basketball while rehab? Run. Pwede naman po. Medyo light lang po nga yung shooting at dribbling. You can also do some specific exercises for basketball din, no? Hindi po bawal yung mga movements na yan if you have injuries. So make sure lang na hindi nagti-trigger ng pain. Tapos after you rest sa gabi, make sure na hindi nag-i-increase yung pain. Yun. Pwede po. So as long, wag mo lang ipilit na basketball to the point na nag-i-increase yung pamamaga, tapos mahirap na igalaw. So wag lang po nga. For shoulder dislocation, depende po yan, no? It usually takes 8 to 12 weeks din. And depende din po yan sa specific na exercises. So importante lang po sa shoulder dislocation, no? Yung rotator cuff here, mga exercises lang ganyan, stabilization exercise, palabas. Kasi yung rotator cuff is nag-help na yan na mag-stabilize ng shoulder joint para mapasok yung sa socket niya. Tapos make sure to check if may tear ba sa rotator cuff. Ang goal nyo lang po niyan is ma-full ng pag-raise, sideway, tapos yung strength ng mga rotator cuff at mga scapular blades. Make sure na ma-hit yan ng mga PT nyo. So ganun, yung mga time frame yan, it usually takes 2 to 4 months. Depende if gaano kalala yung shoulder dislocation. Normal, ano yun po ba na may sumakit pag nag-stretch ka ng ankle since 2 weeks mahigit na yes po, if ever hindi nyo pa nag-rehab. So actually, try nyo po ito yung exercise, no? Pag-stretch, pag-calf raise, pag-calf stretch, may sakit. Yeah, possible po yan, no? Kasi may pamamaga pa yan. So, gawin nyo lang po ito. Here, yung nasa video ko. Tapos, make sure yung ankle mobility muna yung ita-target muna natin. So, ito yung dorsiflexion here. Pag wala pang ganito, paangat, medyo stiff pa yan. So, we want to use this gel, okay? Tapos, stretch nyo din. Pag ganito. Here, para sa calf muscles. Pero normal lang po yan, no? If ever 2 weeks pa lang. So wag mo muna i-stretch kasi maga pa yan. So delay mo muna yung stretching mo, mga nasa 3 to 4 weeks. So make sure lessen niyo po muna yung maga, okay? You're welcome po, Sir Reynald. Tapilok po sa ilang araw, mag-heal, and mga exercises para mag-lit. Tapilok, depende po yan pag may tatlong klase po tayong tapilok, okay? It's the grade 1, which is yung kay Anthony Davis, yung parang tapilok lang, tapos he still continue to play the basketball. And grade 2, which is we can consider with D'Angelo Russell, no? So against Golden State, na tapilok lang, tapos mga ilang weeks siya nakapag-rest, so grade 2. But for grade 3, medyo malala na po yan, no? So actually takes surgery or depende sa diagnosis. But usually for grade 1, it just can recover from 3 days to weeks or 1 to 2 weeks recovery niyan. Pag grade 2 lang or grade 2, mga 2 to 4 weeks, depende din. But for grade 3, medyo matagal po yan kasi naputol talaga yung ligament. So mga more than 8, 12 weeks. Tapos mga madaling, in order to heal the ankle faster, we need to solve or address the pain, inflammation, the maga. So wag muna natin ipilit na ilakad, talon, takbo, sports. So make sure if nagtitrigger yung pain when you walk, sports, i-delay muna natin, no? Delay muna yung stretching, delay muna natin yung strengthening. Wag muna ipilit kasi may pain pa eh. So if you want to heal your ankle faster, we want to respect the pain. So familiar po kayo sa RICE method. So we want to decrease. Tapos if ever nagde-decrease na po yung pain, we can introduce some strengthening exercises on your ankle sa outer side ng ankle. So marami po akong exercises dyan, especially sa playlist ko, ankle sprain rehab. Check nyo lang po yung playlist ko. If ever wala po kayong pain, maga, tapos okay na po siya i-stretch, okay na po siya i-strengthening, gawin nyo po yon. Tapos if you can do walking na, makapagtakbo na kayo, make sure nyo din na i-strengthen yung stability natin, yung balance, para ma-reduce yung re-injury ulit. So ganun lang po yung phase ng rehab. Ngayon po kaya parang pupulikatin yung arms to shoulder ko kapag napupush up. Una, if you have discomfort on your shoulder while doing push up, make sure i-correct muna natin yung form, no? Pwede dahilan niya is yung form, pwede din yung intensity. Baka too much lang po yung nasa floor. You can regress it by incline push up. And you can also reduce the frequency which is how many days you're training your push-ups per week. You can lessen it. You can less to 2 days in a week or rest muna. So may madami yung mga factors. And you can regress na lang po muna sa slanting na lang po muna, or you can lessen the reps, the sets, tapos focus ka sa pag lower down, which is the eccentric part. So slowly down lang, mga 2 to 4 seconds, emphasize yung lower down, tapos up, tapos slowly down, para po ma-engage yung mga muscles, tapos hindi ma-strain yung iba. You're welcome, Joe 7. From Jacob, boss, saan po yung ini-explain mo kanina? Sa ankle po yun, sir. Yung ini-explain ko sa ankle po yun, kasi nag-ask yung isang viewer natin na bakit daw masakit yung paa niya while stretching, tapos 2 weeks pa. So make sure to delay muna natin. But if ever nagde-decrease na yung pain, you can perform that ankle mobility drill para to increase yung dorsiflexion. So again, importante po yan yung dorsiflexion if ever you're basketball player, no? Para hindi po kayo mag-develop na mga Achilles tendonitis. Kasi pag lock yung motion yan, tapos mag lunges or yung mga motions na mga basketball, parang driving sa basketball, need po ng ankle dorsiflexion yung ankle natin, especially kakatapilok lang natin, no? Medyo stiff pa yung ankle, so that's why you need to do that ankle mobility exercise. Ilang araw healing ng knee injury? Una is depende po sa what type of knee injury. Tapos pangalawa is depende sa severity. So we have grade 1, grade 2, grade 3. So for grade 1, medyo less lang po yan, no? Parang konting stretch lang po ito. For example, this is your tendon po. So if na-stretch lang po, grade 1 lang po yan. So it can recover from 2 to 4 weeks. Depende din. But if ever na-strain yan, may punit. So grade 2 yan. As long as hindi po siya na fully tear. Mga 6 to 8 weeks. Tapos it can lead up to 12 weeks. Tapos if ever complete tear talaga, surgery needed yan. Tapos yung recovery phase, it usually takes 6 to 12 weeks pa din. Ganun lang po. It takes months talaga. Kaya tinatawag natin na rehab. That's why we called it rehab, because it's a long process. We need to do some rehab exercises 3 times in a week. Hindi lang po yan overnight, no, na maka-recover. So that's why we called it rehab. Dok, after ng knee injury, need na lagi magsuot leg sleeve or knee? Actually po, after ng knee injury, ang purpose lang po ng mga supporters or sleeve, especially nakita nyo si Stephen Curry, di ba? Injured niya lang sa shoulder niya, tapos may astig na full sleeve siya. So ano lang po, nag-give lang po yan ng feedback, support, but
tayo lahat ng sizes is naka-sale tayo dyan. Kahit saan po yan ha, pindutin nyo po yung lahat ng size.
Hello.
Sino tama?
Hello.
Hello?
Hello po.
Hey.
Nagla-live selling po kayo?
Brother. Can you hear me?
Yes, I can hear you.
Brother. What are you
Yeah,
doing?
yeah.
What are you doing?
Paano to ma-close?
What are you doing, brother?
Hello. Hello, Sir Lucy Factory. Hi, sir. How are you?
You know what that is? You know what that is?
6 minutes mag-live ako.
Brother.
So you're introducing some shoes?
Shoes.
Yeah.
You're Philippine?
Where are you from? Yeah, I'm from the Philippines.
China.
Oh, you're from China.
Uh,
Actually, I'm doing a live and
and we are shoes factory.
how? Yeah, yeah. How can we end this?
You know this?
No, I don't know that. So
You know
again,
what?
if you have supports, ako supports is really important din, no? Pero supplements lang po din po yan, no? Huwag niyo baliwain yung rehab or exercises. Kasi pag supporter lang, tapos walang tamang exercise, rehab, baliwala din po yan, no? So parang, yung parang supplements din ng gym, if ever hindi po kayo ng workout, walang diet, tapos supplements lang, it's really ineffective, okay? Guys, paano ba itong kick itong isa na to? Ano po magandang activation for 9 months post ACL? So, actually, 9 months no, medyo matagal na yun. But if ever po na hindi pa activated yung quads nyo, for example, you're trying to squeeze your quads, tapos hindi nyo pa ma-feel, you can feel some activation to the other areas. So, make sure first muna no, is activation sa quads, yung quad settings, tapos do that consistently. Tapos if ever na po na medyo nagre-recover niyan, progress natin yan into a long resistance band. Ganito po. Paano ba ito makick itong isa na? Paano natin makick to? For example, if ever naghanap po kayo, if ever you're looking for a quad activation, uh, you can click this on my shop. So, gamitin nyo lang po to. So, pasok nyo po dito. So, for example, naka-stabilize dito. For example, you can do this here. Isang progression. This is just a progression of your quad settings. So, here, squeeze nyo lang to. You can squeeze for 3 to 5 seconds. Then relax. Squeeze ulit. And you can also do some here lunges. For example, naka-lunge po kayo. Tapos, as you go up, squeeze your quads. Balik ulit. Lunges. Here. Guys, end muna natin yung live kasi kakairita. Hindi ko makick yung yung isa na to eh. Balik na lang po ako live bukas. Okay. So, thank you po sa mga nagtatanong. You can message me sa IG po if ever you have question, okay?